Living with an ostomy comes with many changes, but with the right knowledge, you can lead a comfortable and confident life. In this video, we'll cover everything you need to know, including pouch changing and emptying routines, clothing options for comfort and discretion, how to resume daily activities with ease, travel tips for a stress-free journey, navigating intimacy and relationships with confidence.
Pouch changing routines. So again, this is going to be very dependent on the type of ostomy that you have. If you have the ileostomy, you're going to be emptying it a bit more frequently because it tends to be looser. Colostomies, usually the first 4 to 6 weeks, your bowel habits are a bit irregular. You will fall into a new baseline. So watching for that. If prior to surgery you only had one bowel movement, you might have 1 or 2 in a day, which is great, but you will find some sort of regularity with the colostomy. A urostomy, on the other hand, that is active all of the time. Your kidneys are filtering constantly, and so that's going to be a little bit different. Wearing a leg bag is going to help minimize the amount of time you have to empty that pouch because it gives you that extra reservoir to hold that urine. When you're changing your pouch, you want to choose a time when it's least active. So an ileostomy, for instance, typically you will have the least amount of activity first thing in the morning before you've had anything to eat or drink. So during the night, a lot of people with ileostomies are up at least once during the night to empty that pouch. But come morning time, if you haven't had much to drink overnight, it's going to quiet down somewhat. Colostomies, that's going to be, again, really dependent on what your routine is. Some people, it's first thing in the morning, but I do have some patients with colostomies that say they're a little bit more quiet in the afternoon or late in the day. And so they may choose to change their pouch in the evening. Again, with the urostomy, probably first thing in the morning, if you haven't had a lot to drink overnight, will be a little bit less as far as that output goes. Now, if you're going back to work and you're planning for the days that you're changing your ostomy pouch, you want to allow that little bit extra time. And I will also say that ileostomy wear time for the pouches is about 3 days. Some people get 4. You don't want to push it too long because you don't want to, the longer you wear it, the more apt you are to leak. So you want to just be proactive and change it. Colostomy wear time is typically anywhere from 4 days to 7 days. I do recommend about 5. Again, you don't want to wait for it to leak. You want to be proactive. Urostomies are anywhere from 4 to 7 days as well. So keep that in mind. You do want to allow that little bit extra time on the days that you are changing your pouch. Now, again, that pouch emptying routine, you do want to empty it when it's 1/3 to 1/2 full. That extra weight will weigh it down and make it more likely to leak. So you want to reduce that risk. Before leaving your house, it's a good idea to empty that pouch. That will extend the first time you have to empty it in public. So say you're going back to work, empty it before you leave. Maybe you won't have to empty it till lunchtime. And again, with the ileostomy, it might be a little bit before then. You do want to keep the supplies you need close at hand. So if you happen to have a private bathroom at work, that's great. You can keep your supplies right in there. If not, keeping something in your pocket. They do make travel size deodorants and lubricants, and flushable wipes are a good idea to have around. So keep that, or bring your pocketbook into the bathroom with you so you've got all the supplies that you need. And then your diet choices. You do want to minimize gas. So you're going to pick and choose what you're eating while you're out. You're going to avoid those foods that increase gas and increase output. So if you're eating higher fiber foods earlier in the day, and maybe you're going out to dinner in the evening. Now, your clothing options. I know I've done some webinars about clothing, but here, as far as routine goes, no clothing is off limits, so you can wear whatever you want, but you do want to keep in mind that maybe some of the tighter fitting clothing might keep you a little bit more uncomfortable. So consider wearing longer flowy tops, high-waisted slacks, pleated trousers for men, A-line dresses. They could be fitted at the top, but they tend to flare out at the waistline. So that will help hide your pouch. Wearing patterned clothing or dark colors will help minimize the outline of the pouch. And then there's those undergarments. I love the wrap. That's perfect for stomas that are above the waist. It's perfect for stomas below the waist. And then there's the stealth belt. And a lot of the men do like the stealth belt. And again, the wrap, I see that used by both. Very, very helpful in keeping things minimized. Now, resuming activities. I know in the beginning, it's a little bit hard to think you can be active, but you can. And things such as yoga, there's certain clothing you can wear that will help you with that. Yoga pants offer support. They're a little bit more tight fitting. And then your pouch is just supported with that. If you're doing contact sports, you do want to be careful about injury to the stoma. So a stoma guard or a stoma dome, those are really good choices to keep that protected. And incidentally, the stoma guard and the stoma dome is great for stomas that are above the waist. It will help smooth it out when you're wearing a shirt. Things like lifting weights. I would first check with your doctor to make sure you're past that phase, but you are at risk for developing a peristomal hernia. So you should be wearing a support belt if you're doing any type of lifting. That will be very important to reduce your risk for that hernia. If you're running or jogging, sometimes that can feel uncomfortable with your pouch if it's not supported. So you do want to consider that support belt. Some people will go ahead and wear bike shorts because they fit a little tighter. They're spandex, kind of like that yoga pant, and that will offer support. And then Spanx. So women will often go ahead and use Spanx as support for those types of activities. Swimming. Swimming is great. You can swim with your ostomy. You can consider using waterproofing accessories, the Shore Seal ring, the barrier extenders, the elastic barrier strips. And then there's a product out there called Dry Pro. And that you wear, it's got something you pump up and it makes it fit nice and snug and it makes it more waterproof. And then of course there are swimsuit options that are ostomy specific. There's swim trunks for men, and then there's also swim bottoms, skirts, shorts for women. Right? Ostomy Secrets carry some of those. But you'll find them online. Just Google ostomy and swim, and you'll find lots of options. Gardening. I love to garden. And what I found when I first started doing this, and with my ostomy being pretty new, I decided to use something smaller to put my clippings in, and when I was digging out weeds and things of that nature, so I didn't have to carry anything too heavy. So that was very helpful for me. And if you're really heavy into gardening, you can also consider wearing something that's going to hold your pouch nice and tight and support it as well. Now, if you travel, say, for work or you're a routine traveler, there are certain things you can do that will make you feel more comfortable. You do want to look at getting a TSA travel card. And you can go to the Ostomy Association website and they have the cards. And you'll see a picture of it here on the slide. That's very helpful. You do want to pack extra supplies. In general, they say pack double what you normally would use, because when you're away, you don't want to worry and have that stress of running out of supplies. So always bring extra. It's easier to bring some home than for you to worry about not having enough. You do want to pack them in a carry bag, or at least some of them, because what happens if your luggage gets lost? So you don't want to be stuck without having supplies. And especially since these supplies are not something you could run to the drugstore for. So do pack them in a carry bag. Travel size accessories, and I put a couple of them here. Air freshener, travel size, and you can bring them on the plane, as well as the lubricating deodorant drops that you can put in your pouch. There's plenty of other ones out there, but these are just a few. Now, returning to intimacy. So that's something that can be in a lot of people's minds. First thing you want to do, talk with your partner. You have concerns, I'm sure they have concerns, and it's always a good idea to talk about it first. And you do want to start slow, so talk about that as well. Before you start an intimate moments, you want to empty your pouch prior to beginning. That will be important. You'll feel more comfortable. You can consider using those lubricating deodorant drops in the pouch just for a little more confidence. You can consider a pouch cover. So here is a wrap. So the upper one is typically men would wear. It's more skin colored, good choice. And then for women, they have lacy ones. They have smaller ones for people with colostomies. This would be one more for an ileostomy. But there's also those pouch covers that you can use as well. And this will hold your pouch close to your body so that it's not, moving around in the way during intimate moments. People with colostomies, if you have regular bowel movements and it's a time that you're going to be less active, there's stoma caps. So this is, it's small, certainly not as big as any of the pouches. And so it's going to minimize that awkwardness of a pouch. As far as positions go, any conventional position is fine. Keep in mind though, depending on the type of surgery that you've had, if you've had rectal involvement for surgery, say rectal cancer, or you have a J pouch, those certain positions might be uncomfortable for you. So just keep that in mind as you're beginning your new intimacy with your stoma. And I do just want to point out, never use your stoma for penetration. That's very important. It's dangerous and you can injure the stoma.